Hello everyone, my name is LaShonda Kimmons, and the following presentation is Shifting to Dayforce on behalf of Encompass Health, and this is an HRIS initiative. Encompass Health of Memphis, Tennessee is a for-profit organization that services both inpatient and outpatient needs along with home health services. Encompass Health services 400 plus locations in 39 states with 43,800 employees. Encompass Health recently announced the expansion of their hospitals in 13 new locations with the anticipated start date of services beginning as early as the fourth quarter of 2020 to 2022. The entire organization's HR department maintains a steady operation by juggling 6 HR systems to perform daily tasks from the beginning to the end of the employee life cycle. According to the HR director of the Memphis location, the current challenge is data integration issues with a few systems' inability to read the other. The director also states that a few of the documents must be manually uploaded to update personnel files, thus bringing in room for human error, misrepresentation of real-time data analytics, and decreasing the level of employee proactiveness with too many systems to maneuver. The goal of the project is to find an HRIS solution that supports organizational efficiency by improving time management. The proposal serves to support the idea that an HRIS implementation will collect high volumes of data with high accuracy without manual activity, which supports organizational cost effectiveness. The HRIS can create a way for Encompass Health to have real-time data while decreasing the time spent on transactional duties and promote transformational HR by improving leadership support and employee satisfaction. The analytics will be readily available to make strategic decisions based on recruitment, onboarding, development, retention, exit and separations, and other HR needs, and enhance performance management. Why is there a need for change? The importance of integrating to one HR system for Encompass Health is necessary for improving time management going forward with the openings of new facilities. With growth comes the need to evolve the organizational structure and embrace technology trends to react appropriately to the company's situation. The socioeconomic impact of COVID-19, along with the opening of these facilities, will demand that HR professionals provide expanded services of higher quality, faster, and seamlessly linked with other corporate functions. In addition to this, the high demands of our society have increased the pace for the expected turnaround time for employees, managers, and leadership needs, forcing Encompass Health HR professionals to prioritize their duties and reduce unnecessary time-consuming processes. A study conducted by Kumar and Paramaster revealed a few surprising factors in relation to the effectiveness of an HRIS. The study tested a hypothesis on the interrelatedness of the impact of implementing an HRIS in conjunction with HR functions, time management, cost management, and managerial satisfaction with the system. With the significance level being at 1%, if any of the above factors are higher than the numbers, we can conclude that the implementation of one HR system can impact the overall efficiency of the organization. The regression analysis shows a strong impact of an HRIS with the following statistics. As you can see, the time management is at 0.511, cost management at 0.517, managerial satisfaction at 0.515, and organizational efficiency at 0.554 at a 1% significance level, all of which are above the 1% mark, revealing just how impactful the HRIS can have a domino effect on the entire organization. The push for an HRIS system creates a great circumstantial change necessary for the current expansion of the organization. An HRIS that supports and caters to Encompass Health's needs is Dayforce, an HCM that services the entire employee life cycle. The tool supports organizational efficiency by harnessing data on one cloud software with readily accessible data, eliminating the need for complicated integrations to simplify workflows, increase accuracy, and enhance compliance. This user-friendly system decreases time spent on tasks by automating HR processes. Dayforce will enable Encompass Health's HR professionals to improve HR, payroll, benefits, workforce management, and talent management processes. The benefits of implementing Dayforce is the ability to complete the same 6 functions that Encompass Health's current HR systems conduct, which is recruiting, compliance training, employee files, performance management, payroll, and budgeting. Dayforce aids in scheduling interviews via phone, email, or text, and tracks onboarding steps for new hires, while offering useful updates on healthcare information through compliance training for employees. Employees can safeguard their personal information by utilizing the self-service portal and notifying users of urgent matters that need to be corrected. The performance management feature is set to assist with annual performance reviews, peer reviews, development plans, and flexible goal setting. Payroll is made easier with quick data entry, readily available reports, and continuous data calculations to reduce time spent on tedious batch work processes. Budgeting is made simpler with these same reports to manage overtime, forecast compensation, bonuses, and commissions to ensure that these expenses are not exceeding the allotted employee expense. A few limitations to Dayforce have been found through user reviews that may help EHC eliminate future complaints. Addressing these issues now will aid in knowing key questions to ask Dayforce if the vendor is considered by Encompass. When requesting services, it's vital to know and to address all the features that are included to make sure the right features have been added for full support to Encompass. One company did not receive the features shown on the demo, and when the system was implemented, it caused frustrations with additional charges for services and technical support issues. This challenge may be resolved during the earlier phases by selecting the features directly related to Encompass needs. The vendor and EHC can resolve this matter by communicating one another both successes and failures on the progress throughout each area of the project from start to finish. Another common issue found is the number of errors found when generating the payroll and HR data. The system uses a unique way to retrieve reports by matching levels assigned to organizational units in conjunction with employee data. However, if the employee is not assigned in accordance with the organizational units, the system determines it as a blank match, resulting in an error. If EHC were to consider Dayforce, it's pertinent to make sure employees' role, department, site, and organizational unit is in direct relationship to how the company seeks to retrieve data to deflect this issue. To do this, HR personnel should import the HR records via Excel, allowing direct access to system administrators and HR personnel for uploading files. Ideally, this feature inhibits the ability to catch errors associated with incorrect ordering of data, duplicate employee files, and mismatch on personal information such as address, tax, location, social security numbers, or SIN values. If this information is processed correctly, it will result in greater accuracy to influence decisions based on facts. Measuring the rate of success is simple by conducting studies centered around the same principles as the previous slide. HR functions may be measured based on distinguishing how the reporting tools have been used to improve employee metrics. For example, if there are complaints from patients or families about the lack of assistance being used to monitor their loved ones, Encompass Health can pull reports associated with productivity. Those reports may show an increase in the last month on the number of unscheduled absences in an area due to flu season. This is just cause to speak with management to see about bringing in seasonal professionals to negate from receiving bad client reviews to support the workforce management. Time management can be measured on the rate of productivity by gathering stats prior to the implementation and essentially monitoring this on a monthly, quarterly basis after the go-live phase. Cost management may be leveraged based on eliminating the need to hire additional HR assistants, as Dayforce will provide support. Simply reviewing the return on investment will show a direct relationship. Managerial satisfaction can be measured by understanding how many leaders are using this tool by retrieving feedback from surveys based on questions catered to the entire decision-making improvement, cost reduction, and the improvement of budget control, business transparency, a clear vision of the business organization, and a clear understanding of HRM practices. The following will show a hypothetical formulation to show the number of years Encompass Health can expect to receive an offset on the purchase of Dayforce by utilizing the payback method, if the average cost per employee remains constant. So as we can see, the average cost of Dayforce per employee is $11.50 times the number of employees, which is 43,800, times the number of months, which is 6,044,400, which is the total cost of Dayforce. The payments from customers, which would be $2 million, and this is hypothetical, minus the maintenance of the machine at $500,000, which is deducted from $2 million, is $1.5 million in cash inflow. If the cost of the machine is divided by the cash inflow, we see that the return of the investment is 4 years to offset the purchase. The following shows a timeline of activities set to shift to Dayforce. As you can see, the project will start in late September of 2020 and ends in September of 2023. I will show the following activities breakdown and communication strategy on the following slides. In phase 1, we will begin the planning and evaluation stage. We'll begin with a call to action and receive buy-in from stakeholders and send an email to meet with the key stakeholders to discuss the need for change. Next, we will begin a kickoff meeting and ask for volunteers to support the plan from each department by conducting roundtable meetings with department managers and have one-on-one meetings with departments to discuss any fears, issues, and concerns of the actual implementation. Next, we will form the team and discuss the why of the project. The roundtable discussions will be used to brainstorm on the features of the collective group and what they would like to see as the end product. This will be conducted by having luncheons and outings to build positive team morale. Next, we will evaluate Dayforce demos by testing the demos to see what features are good and bad for the organization, and examine case studies of companies who use Dayforce and are like the organization. We will email members on the team, retrieve feedback each week over the course of 6 weeks. Each week will cover a different function. And then the 7th week, we will compose a compiling of a list of the feedback. And we will also email members on the team as the same in the communication strategy above. Lastly, in this phase, we will conduct the vendor financing by retrieving feedback from demos and case studies and incorporate these ideas into a list to examine both direct and indirect costs. We will meet with the finance director to set a defined budget in alignment with the estimated timeline to implement Dayforce. Phase 2 is implementation. We will scope and plan the implementation roadmap by restructuring the original timeline as needed after financing has been made available. We will meet with the various department heads along with project teams to discuss timeline further in depth to avoid any existing priority projects in the organization. Next, we will conduct data and integration transitioning. We'll integrate the current internal and external HR systems into Dayforce. We will inform users via email and newsletters of scheduled days the system will be down for integrating information to Dayforce. Lastly is the HR process re-engineering and modular implementation. We will redefine the process of conducting HR functions by breaking this down into 6 sections for each task for performing HR duties. We will be communicating this via email to HR directors for assistance on ways to reduce costs by minimizing unnecessary work processes. Phase 3 is our go-live phase. We will begin by testing any last-minute escalations. We will conduct this by doing daily and weekly reminders sent in regards for the testing of the actual system. We will dedicate 4 months and break it up into 1 month for each region. Next is the transition into production, in which we will also do daily and weekly reminders in regards to the testing of the actual systems, and we will do this over the course of 4 months, and it will be broken down 1 month for each region as well. Lastly is the culture shift in HR and the cultural shift in the organization. We will train direct users and employees on the self-service portal, and we will also communicate the benefits of the new systems by using training sessions with a trainer provided by Dayforce and Encompass Health. We will dedicate 4 months with 1 month dedicated to each region as well. Phase 4, or post-go live, we will request feedback on the new system by sending out surveys to measure the impacts of the new HRAM tool to measure the impact of change. We will provide long-term support by sending out emails for bi-weekly webinars for additional training through various techniques such as tech support with Dayforce along with IT support from Encompass. We'll do so by sending out emails, newsletters, an internet contact number, and website for direct access to immediate needs. We will conduct periodic audits and system performance mapping through group meetings with the original project team and address the objectives of the project to make sure every issue has been resolved. We will continue the maintenance of the system by conducting monthly notifications and sending emails to IT to update any kinks within the system. In conclusion, I hope that Encompass will consider Dayforce as a resourceful solution to address your company's current needs. I know that shifting to Dayforce will aid in improving HR functions, time management, cost management, managerial satisfactions, and organizational efficiency. The additional support will prove to be a successful tool and aid in your future expansion. Thank you.